Good morning, everyone. My name is Pauline Joe. I'm a therapist here at LART Wellness Group. And today, the topic I wanted to talk about was trauma informed care. To start off with, I'm wondering if you, Xiao, or you, Courtney, have heard of trauma informed care?
No, I have not.
Okay. What about you, Xiao?
I have tried to try to get some more information because I do have clients who have trauma and want to work on trauma. So I do get supervisions around about like the treatment, informed like treatment, and also try to get some more trainings and also like reading some books about yeah.
Trauma. Awesome. Well, not a worry at all. It's kind of something that I learned in a couple of the nonprofits that I've worked with before coming here. So I actually wanted to give you guys the best definition possible. I did a Google search. I'm on Trauma Informed Care um, Implementation Resource Center's website, and trauma informed care, according to them, seeks to realize the widespread impact of trauma and understands paths for recovery. It recognizes the signs and symptoms of trauma in patients, families, and staff. It integrates knowledge about trauma into policies, procedures, and practices. And it actively works to avoid re traumatization amongst clients and staff. That being said, I'm wondering, where have you guys seen trauma in your clients, or like what kinds of trauma?
I would say for me, so far, the only trauma that my clients or a few of my clients may have experienced, um, I would say is, of course, the loss of someone. Other than losing a loved one, there has not been any type of, I guess, other trauma, so to speak.
Okay, so the major thing you're seeing is the trauma of grief and loss.
Yes.
Wow, that's really tough. I'll definitely get back to you on say how you handle it, but see how you had mentioned too that you have clients who have trauma.
Yeah, I have clients who experience really really bad childhood like neglect and also like emotional and like psychological abuse. So yeah, which is really traumatic. And also yeah, for others like this is one of my clients, and I do have clients who have experienced like being bullied at school, and these are all very traumatic experience.
Yeah, I can certainly imagine, especially in childhood, having experienced abuse in any of the forms is incredibly traumatic. Kind of adding to what you guys said, in my work, I'm seeing a lot of, say, systematic trauma. So, kind of coming from the macro level, that there are, different policies that make it difficult for our clients at times to be able to get, say, their basic needs, whether that be Social Security, TANF, food stamps, even unemployment, and kind of trickling it down to, say, like the micro level, like the one-on-one level. I definitely agree with you, Sia. I've seen clients with a lot of childhood trauma, whether that be physical abuse, sexual abuse. Um, I'm seeing a lot of kind of this collective trauma that we're all experiencing alongside our clients of experiencing this pandemic. This pandemic has been absolutely traumatic in many different ways. So that being said, I'm wondering from you two, how have you guys addressed those traumas in your sessions?
So the one client in particular that I have, um, she's a 40-year-old African American female. I'm sorry, 41-year-old African American female. And she actually lost her mom last year. So I've been trying to focus on, because although the loss of her mother was not her presenting problem or presenting concern, um, I have incorporated different coping skills into our sessions for her, because she's been using work as a way to, I guess, keep her mind busy, and, just to keep her mind off of the loss of her mom. So we've been incorporating that, and it's actually been going pretty well. And I've also been focusing on um, reframing and her communication skills as well, because one of her presenting concerns is that she does have challenges with communicating with others without either being frustrated about it or feeling as though it's going to turn into a confrontation verbally.
Wow, that sounds really hard for your client. Um, that kind of in itself can be challenging to go from having, say, this loss, expected or unexpected, and then having to reintegrate yourself back into work. Um, and so it sounds like you're really working on having your client know the best ways to communicate, so that as she's, still adjusting to her new life and having to, you know, remain professional at work, she's able to still meet herself where she's at and communicate to other people like her needs or like what she's capable of doing.
Absolutely.
Alongside what you said, I definitely think it's important that we, as I've heard, give space. So what that means is, really showing the client that we're there for them and that we want to spend as much time with them as possible as they need to be able to, process whatever trauma they're experiencing. Um, and also acknowledging that this really is difficult, and that what they're experiencing is absolutely real and it's affecting them, and that that's uh, okay that they are reacting, say, in the way that they are.
Exactly.
Um, I'm wondering, what do you think, Courtney? I know Sio had to step out for a second, but what do you think we could do maybe as an organization to maybe implement more trauma informed practices?
Um, well, I know I'll say from my perspective, um, in order for me to continue to grow as a competent counselor, I know on my end I could do more research and studying and just reading more about how to um, effectively assist clients who are experiencing trauma related concerns. Um, Let me see. For the organization side of it, um, I guess we could um, have something either developed or attend, I guess, like a seminar or a webinar something like that that'll, um, of course, focus on continuing education, but as well as give us, I guess, some more tools and skills to utilize throughout our sessions. Um, and I'm trying to think of something else, just besides like seminars. Yeah, as of right now, I'm going to say maybe like trying to research and find some seminars that will assist us all, especially counselors who have yet to experience working with clients who have experienced trauma. I think that'll be a huge help.
Yeah, there's definitely something great about, especially at our advantage, kind of being brought up in the technology age, that we can kind of do that self research, and I agree. In kind of like a larger sense, like the large wellness sense, I would absolutely love to try to set up a time that we can do like a seminar. Um, I believe in like past organizations, I did have seminars as well, whether they were directly called like trauma informed practice or they were like around that topic with the infusion of trauma informed practice. Um, there definitely are some good readings that I will probably send to the group. Um, Again, the website that I'm on is Trauma Informed Care Implementation Resource Center. This was a basic Google search. Another one I'm thinking of, it's really escaping my mind, but it talks about how trauma affects not only our brains, but it can also affect our bodies, and which can almost manifest into like different illnesses that we see either in ourselves or with our clients. That being said, again, I'm not sure if Xiao is back. Um, I'm wondering, Courtney, in your particular program, have you guys ever gotten any resources on like how we could help our clients through, again, this kind of collective trauma that this pandemic continues to bring?
Um, in my particular program, I'm in the clinical mental health program at Walden. In my program, the most recent opportunity that has been given to us as of right now is a um, seminar in regard to suicide and suicidal ideation. And then we also have another seminar coming up that I signed up for in regards to what is it? I might have to actually sign on um, to Blackboard just to see what the seminar is, but I definitely signed up for both. The one for the suicide and suicide ideation, that one is this weekend. So I'll be attending that this weekend and it's virtual.
That sounds like an incredibly vital training, to understand why do people become suicidal, how do we identify that they are suicidal, and how do we work as quickly and as efficiently as possible to get them the best care. Interestingly, again, kind of that concept of like not wanting to re-traumatize clients. Um, Sometimes, if you look at certain helping industries, even maybe including in the industry we're in, practitioners do have the best intentions. I firmly believe that. But again, because trauma informed is still being built up, sometimes we hope that we're motivating them or we hope that we're supporting them, and we are, but at the same time, we may be reminding them of something that traumatic could have happened in their personal life. And interestingly, how it comes back into the session, or it comes back into that engagement, is they could be acting out, they could be actually disengaging because we might have said something in a certain tone, or we had a certain like rule that like made them feel constricted or trapped, or any of that sort. And so they either like want to express how they feel, or they just don't want to participate at all. Sometimes it disrupts like the trust building process. And so I'm kind of on a tangent at this point, but Xiao, what I was talking to with Courtney about was like ways in which we can try to have more trauma informed work on an individual level, as well as like a loyalty wellness level. I'm wondering if you have any thoughts on that.
Yeah, for me, like I just because I heard Courtney about the suicidal like the seminar. I think I just went to a suicidal summit. Yes, like on this weekend. It's a long time. Like I yeah, it's online. It's completely virtual, and there are 10 separate sessions, like five on each day. And it's great to hear different speakers and talks with different kinds of perspective and use different kind of like therapies or like resources to help those suicidal clients. And also, actually, they are very inspiring. I didn't go to all of them. I go to six of them, and actually, like three or four of them are very inspiring. And I just think I can incorporate into my treatment. And also, I want to get some trainings about that too. For example, like well, I remember one of the guest speaker actually talk about like the sensory modal psychotherapy, which is how to use like the gestures and the posture that a person shows in the session, try to like help them recognize like how their physically present is actually connecting with their mental status and also their symptoms. It's very cool, and I haven't heard about this before, but I want to know more because I do feel that it's related. Because when she is talking, I feel okay, it's related to some of my clients. Because even though I'm doing on video sessions, like virtual now, and I still can recognize some of them are actually there are some that relate like some postures they show is related to what the speaker is actually talking about. So I think it's really cool. I do feel, and I also like I found a website about like the trauma focused CBT. Is the TFCBT is just focused like how to help clients with trauma by CBT. So I haven't started to do the training, and I'm still looking for a training like online. Yeah, but but I definitely want to do more around this too, and also around narrative therapy. So I'm actually reading several books about narrative therapy to help clients with especially like childhood trauma. And also like I talked to my supervisor about this too, so it's cool. But I haven't got enough training about this. I'm just still working on it.
Wow. I definitely will have to reach out to you, Xiao, about that suicide training. Um, I think I had a training, sounds like it was very similar, but maybe 5 to 7 years ago. So I think it's probably time that I get more training. But I actually never heard of that modality. So there are so many different modalities that we can use. Trauma focused CBT, I actually do use on a daily. So I appreciate that you're interested in that. And kind of going off of what you guys were both saying about suicide trainings, another really good training that may interest you too, it's called the mental health first aid. So it has very similar crossovers. And it says mental health first aid is a skills-based training course that teaches participants about mental health and substance use issues. and it helps us as practitioners immediately address, say, the problem. Um, and especially, again, in those moments where we need to act quickly and we need to intervene when they are at a suicidal level. So, um, very, very good topic. Did you guys have any thoughts on the thoughts of mental health first aid?
Yeah, actually, I have taken I'm not sure it's the same thing, like a psychological first aid. So it's like it's a course on Coursera, and I think it's the speaker is from Johns Hopkins, like from my school, like Johns Hopkins University, to design like a program for mental health counselor, and also like the like also not also on the for the workers, or like on the first line when there's emergencies happen, so people can who are need to react to those crises, so they're able to help like survivors to get through the um like the crisis like more easily, and just have a better prediction of outcome, like after like 6 months after the natural disaster, or like the or the crisis. Yeah, I do remember this. Like I have taken a course about this too, and also I have taken a class in my school. It's about like crisis intervention. So which is also cool. It's working with people with different kind of crisis going on. Yeah.
Okay, yeah, that definitely sounds fairly similar. I know that there are kind of like various names for similar things. Um, as I see, we have about 10 minutes left. My last question was: we as practitioners, at least I know in my particular program, we were taught that um, social workers, people in the helping profession, people in the counseling profession are taught that we are, say, the front lines of crisis, meaning we have to put our clients before ourselves. Um, and although we honorably do that, we're still human and we still have our own issues, our own traumas. And so I'm wondering from the two of you, what is the best way that you guys handle vicarious trauma? So, say for instance, we have a client, they sit down in their chair, they tell their story, and suddenly now we're like, feeling it, and we're really like moved by their story, and it's really affecting us. How do you guys then turn it back and assure that you take care of yourselves so that when the next client comes in, we're able to, recharge and give them the same amount of energy and attention as we did with our last client?
Me personally, what I try to do is, um, when I have my session scheduled, if I know it's on a day where I'm working with a client in particular that's experiencing or has experienced a traumatic event, I'll give myself at least 10 minutes in between those sessions, just so that, again, I can gather myself. And especially if it's a day where it's like, I don't want to say emotional, but it's a really, it's a really heavy session. I'll say that it's a heavy session. I'll give myself just that 10 minutes just to collect my thoughts, gather what was discussed, try to process it, um, and then, of course, still try to mentally prepare for the next session, because I definitely don't want to make that noticeable to the next client that I've just experienced what my prior client was experiencing as they were sharing. Um, so yeah, I just give myself that extra time in between sessions. That really helps me a lot.
Sorry.
Oh,
I definitely agree with Courtney. I'm also like Each of the session, I definitely give like 15 minutes break. I always give 15 minutes break between each of sessions, so I have enough time to refresh my mind and also to be able to like manage my emotions and just go back to like a normal level. And on the other hand, because most of my clients I know, so like their symptoms, their like the severity, and also if like the basic topic we're going to work on like in our next session together. So if I know that I have a client, I'm going to work with him or her about the trauma and more heavy things than other sessions. I would definitely like Courtney to give myself enough time to have rest. For example, like I may have a half an hour break between, so I can have enough time to adjust my emotions and things, and also like I will have a less heavy days a day, so if necessary. It's not always like that, but or I always have a chance to be like that, but if I do, I will. And also like after the sessions, after the whole day of work, I will give more some time to do the self-care, have a good meal, like have a good bath, to be able to relax myself, so I can like yeah, I can prepare for the future sessions together with other clients.
I do really like both of your guys' ideas. The commonality I see is that we must give ourselves space in between and not say schedule clients back to back. I think that's also really important because yes, we do have a really good idea, which is awesome, but sometimes clients will kind of hit us with a curveball. You know, we're talking about something and then they're like, oh, wait, I forgot I haven't processed this trauma. Or, oh, wait, I didn't realize I was repressing something. And you just said something that now prompted me to talk about something else. So I think it's also important not only to be prepared of what we already know, but to be prepared that anything and everything can be shared in sessions. Um, Alongside what you guys said, definitely if it's a, say if it's like I've made it to the end of the week, I've had a hard week, I always, kind of going back to what we might have talked about a couple of sessions ago, I always kind of go back to, okay, what is my routine? What is it that I can do in my control, in my personal routine to kind of recharge myself? And so that I am ready to go on Monday. I think that there's like this underlying belief that isn't necessarily the most effective, at least I don't think so, but this underlying belief that it's like we have to keep working, we have to keep working, we have to keep working, and only when we're burnt out do we then address things. When rather it's best, okay, if we know we're experiencing, that kind of vicarious trauma, to put it in our routine, to maybe switch things up a bit and do something different. Um, and that being said, I'm last question. I thought of one last question, but what do you guys think is something that, again, since we're human and we can experience vicarious trauma, what is something that we can do that's accessible to us that perhaps also is accessible to all of our clients that we can teach them? Yes. Oh, go
Oh,
ahead.
I would say what I try to have my clients focus on is something that I'm actually doing today. Well, I plan on doing today, which is focusing on self care. Um, Again, I agree with you 100%. And it's honestly something that I'm still trying to learn. Because initially, and I might have shared this before in past sessions or group sessions with you guys, but self care for me used to be focusing on, of course, like treating myself here and there, go get nails, hair, all that kind of stuff done. But now, since being a part of the counseling field, and um, how do I want to say this? I guess what I do is I try to self care for me is focusing more on my mental health, so to speak. And I say that because um, although we as humans, we try not to take on other people's concerns or problems. For us, it's kind of, well, I'll say for me personally, it is kind of difficult because, of course, sometimes I'm just like, oh, I want to help this person like so bad. So I have to learn that. Um, One, I have to learn that I have to allow my clients to do the work. I cannot do it for them. So I remind myself of that constantly. And again, I focus on my self care just by taking those few extra minutes or taking a few hours on days where I don't have clients just to gather myself, collect my thoughts, and to, what else? Just, of course, focus on my breathing. That's been really important to me as well, and also focusing on mindfulness.
I like that thought. Um, there is absolutely nothing wrong, man or woman, to kind of be able to take care of like our outsides, right? That helps a lot. Going to the salon, um, getting a manicure, pedicure, and all that. That definitely brings up our spirits. But you're right. We still have to address a lot of like what's going on internally. That being said, I actually have two book recommendations if you guys are into reading books. Um, this kind of helps. This book is more so for understanding clients as well as understanding ourselves. It's probably like the most common book I see in like all of these therapy groups that I'm a part of. It's called The Body Keeps Score. It's a New York Times bestseller. It's by Bessel van der Kolk. This is the cover of it. I have to read this one in pieces because it's a lot, but this is apparently a very good book to understand trauma and how it affects kind of our lives and our brains and our bodies. The other book that I think every therapist should read in terms of trying to take care of ourselves through the vicarious trauma is actually called The Empath's Guide to Survival. I can't remember the name of the author. She is a psychologist, but when I read that book, guys, it was an absolute game changer. Like, I wish I read it in grad school, but I will definitely send you guys that link. Again, it really teaches like practical skills of, okay, so we're all empaths. That's what like drew us to the profession. So how do we use our empathic skills without also not burning ourselves out? Um, so, lastly, Xiao, do you have anything else that you'd like to add?
No, I pretty agree with all of you. Like, both of you, like, I do agree with what you said about like self care, and also I do have my self care too. And like, I add a new routine in my life. Like, I take a walk for an hour every day with my friends. To just like connect with nature, be able to relax, and also like um to make like physically like more healthier. I just feel like living a healthier style. So I definitely agree with what both of you said about self-care.
Definitely, you connecting with nature does help switch things up, and I agree with you that just overall maintaining a healthy lifestyle helps us, kind of manage that stress that can come with vicarious trauma. Um, but as always, want to thank you guys for coming today, and um, I will see you guys soon.
Thank you very much. Thank you.
Thank you.
Courtney, thanks, Shao. Take care.
Bye.
You too. Thank you.